Hi everyone. So today we are going to see about the article on influenza flu. So after coronavirus, now but recently we can see that we are having a problem with the other virus. It is called influenza. So flu influenza is an infection of nose, throat, lungs, which are part of the respiratory system. Influenza is commonly called the flu, but it is not the same as stomach flu virus that causes diarrhea and vomiting. Most people with the flu get better on their own, but sometimes influenza and its complication can be deadly. People at higher risk of developing flu complications includes young children under age 2, adults older than age 65, residents of nursing homes and other long-term care facilities, people who are pregnant or plan to be pregnant during flu season, people with weakened immune system, American Indians or Alaska natives, people who have chronic illness such as asthma, heart disease, kidney disease, liver disease, and diabetes, people with a body mass index of 40 or higher. Although the annual influenza vaccine is not 100% effective, it reduces the chance of having severe complication from infection. Symptoms. So, what are the symptoms for this influenza? At first, the flu may seem like a common cold with a runny nose, sneezing, and sore throat. Colds usually develop slowly, but the flu tends to come on suddenly. And while cold can be miserable, you usually feel much worse with the flu. The common symptoms of the flu include fever, itching muscles, chills and sweats, headache, dry persistent cough, shortness of breath, tiredness and weakness, runny or stuffy nose, sore throat, eye pain, and vomiting and diarrhea, but this is more common in children and adults. So when to see doctor for this flu? Most people who get the flu can treat themselves at home and often don't need to see healthcare provider. If you have flu symptoms and are at risk of complications, see a healthcare provider right away. Taking antiviral medicine may shorten the length of your illness and help prevent more serious problems. If you have emergency symptoms of the flu, get medical care right away. For adults, emergency symptoms can include difficult breathing or shortness of breath, chest pain, ongoing dizziness, worsening of exciting medical conditions, severe weakness or muscle pain. Emergency symptoms in children can include difficulty breathing, pale gray or blue colored skin, lips or nail beds depending on skin color, chest pain and dehydration, severe muscle pain, and worsening of exciting medical conditions. So, causes. So, influenza virus travel through the air in droplets when someone with the infection coughs, sneezes, or talks. You can inhale the droplets directly, or you can pick up the germs from an object, such as a telephone or computer keyboard, and then transfer them to your eyes, nose, or mouth. People with the virus are likely contagious from about a day before symptoms appear until about 4 days after they start. Children and people with weakened immune system may be contagious for a slightly longer time. Influenza virus are constantly changing with new strains appearing regularly. If you have influenza in the past, your body has already made antibodies to fight the specific strains of the virus. In future, influenza viruses are similar to those you have encountered before, either by having the disease or by getting vaccinated. Those antibodies may prevent infection or lessen its severity, but antibody levels may decline over time. Also, antibodies against influenza virus you have encountered in the past may not protect you from new influenza strains. New strains can be very different virus from what you had before. And then what are the prevention we can take for this influenza virus? The nasal spray is approved for people between 2 and 49 years old. Is not recommended for some groups such as children younger than age 2, adults age 50 and older, pregnant people, children between 2 and 17 years old are taking aspirin or salicylate containing medicines, people with weakened immune system, kids 2 to 4 years old who have had asthma or wheezing in past 12 months.
Then immediate thing.
So thank you very much.